First off, every morning at 9 a.m. we usually get the latest updates. Can you go ahead and give us the latest numbers? Where does Arizona stand right now with the number of cases?
So as of today, we are at 1,598 cases with 32 deaths, and we have cases reported from every single county in Arizona.
And yesterday we were at 14. So a little over 100 and a few more deaths. Talk about where we are going with this. A lot of people are worried. We heard the grim numbers of up to 240,000 deaths when this is all said and done. What are we on track for here in Arizona?
So we know that we are going to get many, many more cases. If you watch what's going on in New York, Seattle, and California, we expect to see our number of cases rise. So what we're trying to do right now is to prepare so that we make sure that we have enough care to provide to the patients of Arizona.
What does that look like? Because we've heard of the shortages everywhere else across the country. Although on Monday, when Governor Ducey told us that we have this amount, he was saying the numbers, it sounded like a lot. Is that going to be enough when we reach our peak of what he's expecting hospitals to be maxed out by early May?
So we are planning for worst case scenario, which was an additional 13,000 potential beds and another 1,500 ICU beds. We're hoping that with all of the mitigation strategies that we've put in place, especially the stay-at-home order, the executive order Governor Ducey put into place earlier this week, that it'll be much less than that. And we are working right now to add additional capacity in all of those areas.
I know you guys are looking at different areas where you could possibly put up makeshift hospitals, whether they be hotels. I know the Cardinals Stadium, one of the places. Is it going to get to that point that we need all these other resources?
So what we're trying to do is really protect our healthcare system. So we want to offload patients out of the hospital system and into lower settings where lower acuity patients can recover before they go home. So that's what we're looking at. But yes, they're called alternate care sites.
People are looking at the numbers. Every day they're going up by over 100 more cases. Talk about these numbers. Where are they coming from? Because I know they're not all coming from you guys. So how accurate is these numbers? Are they a lot worse?
So we expect that what we are getting reported to the department is just the tip of the iceberg. So we know that there's a lot of people out there with very mild symptoms who aren't going to see the doctor, who are just staying home and not getting that test. So we get confirmed tests and negative tests reported to the department. So we follow up with the ones that come through public health, and then high-risk cases that may have the potential to spread to other high-risk individuals.
So looking at this, it's really just a fraction of what truly is out there representing what's in Arizona in terms of how many cases. Can you talk about people recovering? How are folks recovering? Are they recovering? We haven't seen any of those numbers yet.
So the majority of the people appear to be recovering. And so with some of those that are reported by commercial labs, we're not going to have the full final follow-up. And so there are surveillance things that we can do. With the ones that we do follow up on, we can match them with death certificates and those types of things to find the final outcome. If there's no death certificate, we assume then after so much time that they have recovered. But it's a very tricky definition, so that's why we're not following the Johns Hopkins model on that.
All right, so we just have to wait a little longer. I know it's, like you said, it's the tip of the iceberg. We've heard we are at the bottom, at the beginning of the curve. Yes. What's your message out there for folks who maybe are still saying it's going to be fine and there's still, we're still staying at home, but, the essential list is still pretty wide, including nail salons and golf courses. Governor Ducey says he's taking the lead from you. So are you saying all these places are okay and safe to go to?
We are recommending that people practice physical distancing, so keeping about 6 feet between you and others if they're not in your household. If you do that, then being outside and playing activities is a great way to get physical activity. And with things like nail salons or hair salons, the techs, because they're dealing with dust, usually wear a mask anyway. And so what we would recommend, wash your hands frequently. If you have symptoms, stay home. We are recommending to businesses to put into place policies and procedures that will encourage physical distancing and make sure that they're screening their employees before they're coming in as well.
All right. So for now, you believe it's truly safe for folks to be going to their hairstylist and safe for the folks who are working these positions.
So yes, we would just encourage, just stay home if you're sick, wash your hands frequently or use hand sanitizer, and practice that good physical distancing while making sure you're staying socially connected.
All right. Dr. Chris, thank you so much. We know this can't be easy on you. I hope you're getting a little bit more sleep. You said not that much these days.
We're working a lot.
All right. You take care of yourself, and we appreciate your time.